And a very good morning to you. It is that time of the month, of course. Our great friend and our resident medico, Dr Clara Chu, is in the studios with us this morning. Another big month for October in health, and it is the Lupis Awareness Month as well. Dr Clara, nice to have you in the studio this morning.
Yeah, thanks, Mick. Good to be back.
Always look forward to seeing your smiling face in here. That is for sure. Brightens the day up no end. Now, as we kick off this one, for those people who don't know what lupus is, what exactly is lupus?
Yeah, so lupus is a chronic autoimmune illness. So this means that your immune system, which is designed to fight off unwanted things like infections, instead attacks your body's own normal cells. And so lupus can affect various organ systems in your body. There are actually several different types of lupus. So I'll go through a few of them, lots of medical names, but just for everyone's interest. So there's one called systemic lupus erythematosus, bit of a mouthful here, or SLE for short. This is the most common type, and it can affect almost any organ in or the body system. Mostly it tends to affect skin, joints. Sometimes it can affect your heart, your lungs, your kidneys, or even your brain. Then there's discoid lupus, a milder illness where most people only have skin symptoms. And then there is a type called acute cutaneous lupus. This is even milder, mostly just causes rashes and a bit of a joint pain. People can also develop lupus as a result of drugs. So this is called drug-induced lupus. It's a reaction to medication, fades away after you stop taking the medicines that trigger your lupus. Then there is a type called neonatal lupus, which is, as the name implies, occurs if lupus causes antibodies that's transferred from the mother to the baby during pregnancy. For the purpose of our chat today, not to complicate things, we'll just call them all lupus.
Yep.
Now, a fun fact. I love fun facts, and I love where words and medical terms come from. So the word lupus, which comes from the Latin word for wolf, can go back to the 13th century physician Rogerius.
Well done.
Rogerius, yes. He used it to describe the erosive facial rash that were reminiscent of a wolf's bite. And that's why it's called lupus.
There you go. There you go. I'm a real facts person too, so I love things like that when they're included in the conversation. It really gives it another edge almost. Now, what causes lupus?
Yeah, so like other autoimmune diseases, there is usually a genetic predisposition to developing lupus. And then if the person's immune system is triggered by something from the environment, like a virus, that's when the symptoms of lupus start to appear. So this kind of progression is quite common in other autoimmune diseases as well, like type 1 diabetes or autoimmune thyroid disease. So I think we've talked about that in the past. So at this stage, though, we still don't know what the specific triggers are for lupus. Some of them, they've been guessed by scientists and doctors, are exposure to too much sunlight or to other UV light, certain medicines and chemicals, infections, certain foods, stress, or even pregnancy can be a trigger for some people. Another kind of like fun fact, listeners may not know, when I was doing my science degree, I did an honours project actually looking at the genes that causes lupus.
Oh, wow.
And so we studied a strain of mice that had a natural predisposition for developing type 1 diabetes, which is the autoimmune type of diabetes. And we gave them an injection of BCG, which is the tuberculosis vaccine. And some of them developed lupus instead of diabetes.
Wow, that's amazing.
So my project supervisor, he discovered that. And so his goal was to study their genes to see what make them develop one type of autoimmune disease over the other. And we were hoping to translate the function of those genes to see what caused lupus in humans.
Wow, that's some really in-depth study there. Very, very different, isn't it?
Yeah.
That is very cool. Now, who is most at risk?
Of the patients who develop lupus, about 9 out of 10 are female.
Wow.
And then the majority of them will develop the condition between the age of 15 and 45.
So picking it up quite early on in life.
Yep,
yeah,
definitely.
Absolutely. Now, what are the common signs and symptoms of lupus?
So, good question. Most people with lupus have mild symptoms. So the symptoms can be quite variable, as we discussed earlier. Some of the more common symptoms are pain, stiffness or swelling in your joints, most often in the hands and the feet, so the smaller joints. Skin rashes that become worse after exposure to the sun. fever, feeling tired, weak and unwell, or weight loss. So some of these are a bit non-specific. It's really hard to kind of like pick it up and go, oh yeah, that's lupus. And then there are also different types of skin rashes that people with lupus may get. So some have a butterfly rash, which is a red or purple rash on the cheeks. Some people have a red patches of skin that are exposed to the sun. It just kind of like has a bit of a hallmark to it.
Yep.
It might look like red rings. And then in other types of lupus, the patches can cause scarring or changes in the skin colouring.
Yeah.
And then you've got some more kind of like even more non-specific symptoms like hair loss, muscle aches, headaches, mouth ulcers, tummy pain. So, the symptoms are wide and varied. And, like a lot of other things that we discuss here on the show, go see your GP, get some tests done.
Sure, you don't want to be WebMDing yourself too much really online, because you'll end up with anything to the untrained mind.
Yep.
Now, so what does a flare look like, and how does it affect the sufferer?
A flare is when the symptoms that someone experiences as a result of their lupus becomes more intense. So flares can be unpredictable, seem to come out of nowhere, often triggered by stress or exposure to UV light.
Sure. We are speaking this morning with our resident medico, Dr. Clara Chu is in the chair, and we are talking about lupus. We'll take a short break and we'll be back right after this. Welcome back. We are talking with our resident medico, Dr. Clara Chu, this morning on the Big Brekky program, talking about Lupis Awareness Month. Now, Clara, what areas of the body are most affected by lupus?
The most commonly affected parts are the kidneys, the joints, and the skin. But as mentioned earlier, it can affect any part of the body.
Yeah, as we've seen before, there's quite a few. It's one of those things that just has a broad range, doesn't it? It's quite bizarre. Now, what are some of the current treatment options?
Well, everyone's always interested in a cure. There is unfortunately no cure for lupus at this point in time, but most people are able to manage their symptoms and enjoy a good quality of life. So this usually requires a combination of medicines and maintaining a healthy lifestyle. So treatment for lupus is very individual and depends on the severity of a person's disease and the organs that are involved. So sometimes a patient might need to try a few different medicines to see what works for them. Their GP will generally refer them to a rheumatologist who is a specialist in joint inflammation and such things to get the right medication for them. There are a number of different medicines that can control the symptoms of lupus. So non-steroidal anti-inflammatory medicines, which are things like Voltaren, Nurofen, are common non-steroidals that we come across that most people might have had access to. So we use that for joint and muscle pain. Then there's a medication that we use to treat malaria, which we can sometimes also use for joint pain, skin rashes, and fatigue. So sometimes these medications have a bit of a crossover effect in what they're able to do.
Yep.
We've got corticosteroids like prednisone for more serious complications of lupus. Then we get to the more interesting stuff. We get to these things called DMARDs, which stands for disease-modifying anti-rheumatic drugs. So this is a group of medications that work on controlling the overactive immune system. And they can help relieve pain and inflammation and also reduce or prevent any joint damage. So that's quite a useful medication. Lots of patients are on that.
Yeah.
And then other ones are like immunosuppressants. Really don't want to go there because obviously, by suppressing the immune system, that then puts the patient at risk of other types of infections. But we do use them in moderate to severe cases. And these medications obviously can present other side effects, which the specialist will need to monitor. But of course, as we always mention on the show, there are lifestyle measures that people can use. So getting plenty of rest, avoiding and managing stress, getting regular physical activity. I know that for a lot of people with chronic conditions that can cause pain, the word pain and exercise often don't seem to kind of like match up, especially in the management of chronic disease. But keeping our bodies moving is really one of the best ways to fight off some of these things and to keep the immune system active as well. Without saying, maintaining a healthy diet, not smoking, reducing alcohol consumption. And then for people where their skin is affected, we want them to protect their skin from sunlight.
Sure, absolutely. Now, if you do end up having a diagnosis of lupus, what sort of support is available?
Yeah, so going to your GP and your specialist would be the first port of call, but the GP, of course, is the first, and then they generally refer you on to a specialist so that there's someone who can manage some of these trickier medications for you. And then there's also the Lupus Association of New South Wales. So I did a bit of digging around on the internet to see what was available, and this one's the most obvious and relevant for our listeners.
Sure. Now, what are the, and we're both obviously stats people, we love facts and stats. Now, what are the statistics of people affected by lupus here in Australia?
So lupus is estimated to affect more than 20,000 people, or 1 in 600 people in Australia.
Wow, that high.
Yeah, so, and there's a bit of a range because obviously being partially genetic in predisposition or cause, European ancestry and Indigenous ancestry can cause a different rate of lupus. So, if you are in people of European ancestry, it's 19 per 100,000. Right. But then in Indigenous Australian, it's 92 per 100,000.
Wow.
So that's quite different. It's almost 5 times higher.
Sure.
And then if we're to translate that to the population of the Central Coast, that would be about 66 people on the coast of European ancestry to 322 Indigenous Australians on the coast could have lupus.
Wow. That's quite a staggering amount there for sure. Now, what is the prognosis for someone who has been diagnosed with lupus?
Yeah, so with close follow-up and treatment, 80 to 90% of people with lupus can expect to live a normal lifespan. Of course, there's that other percentage of people with lupus who may die prematurely if they develop any complications, such as severe kidney disease is probably the main one.
Sure.
Overall, the majority of people could expect to live a normal lifespan with early diagnosis, careful treatment, and frequent monitoring.
Yeah, so I guess the thing is, the big takeaway always, if you do start to present some of these symptoms, get along to your GP.
Yeah, absolutely. And, prevention's always the best thing to do. So, I always love to say to my patients, get plenty of exercise, eat a good, healthy, balanced diet with lots of fruit and vegetables and, keeping away from, your processed foods and
Sure.
your artificial products and those kind of things. So, it's all about the basic stuff.
Yep, absolutely. As always, Dr. Clara, thank you so much for giving up your valuable time to come in and join us this morning. Looking forward to chatting next month about another big health topic, so we will keep you guys in the loop of that one. Stay with us, more to come. This is Rhema Brekky.